So today, let's talk about a few solutions to flabby arms. I see it all the time in my clinic. People come in, it's frustrating. Let's go through 3, 4, 5 most common ones. Number one, don't forget skincare. Everybody puts skincare in the face. Now we've learned, okay, put on the décolleté, the back of the hands, but don't forget the body. And that includes, of course, SPF, but let's move on from there. What are some of the most effective ingredients? Number one would be glycolics because they thicken the dermis. They also help with brown spots that might be pre-existing and help with fine lines. Also think retinols. And they do the similar, they exfoliate, which doesn't help on they don't exfoliate, they increase the turnover of cells technically, but that doesn't particularly help down here. But the collagen building that they provide is key. What's the best form? Really, when you hit the body, you need to be more aggressive than we are in the face. So think about things like peel pads. I think those are the best applications for the arms. But if you have creams or lotions at home, those still work. So don't forget about skincare. Number two, let's go to tightening devices. And many of you have these at home, but they're also in the clinic. So what I'm talking about is not high field or high intensity focused ultrasound, but more so RF, radio frequency type devices. Now these are built from electrical energy. They're either bipolar, so the electricity jumps from one head to the other, or they're monopolar, where it goes here onto the body, whatever the part is, and you have an outlet where the electricity goes to. Often we put a patch on the back for these. So they are radio frequency, they produce heat, and what is the temperature you're looking for? For it to be effective, you need to get the temperature, and this does feel hot to you, so you'll feel it warm. You need to get to 42 to 43 degrees centigrade for about 20 to 30 minutes. Now, the devices we have in clinics, we can change, of course, the depth, okay, and the duration and the heat, and then we can measure to make sure we get there. But radio frequency is non-invasive. It's a heating. You feel odd pulse where, oh, that was hot. And we treat, like I said, 20 to 30 minutes. And we have larger heads now for the body, so we can treat these areas very quickly. You can use these also, of course, in the abdomen, the legs, the cellulite, and so on. But they do work well. Think of 3 to 6 treatments, and then you need maintenance. Now, if you have more loose skin and you still want to use RF energy, you want to think of these two things. One's with RF and one's an injection. The one with RF is RF microneedling. This takes that radio frequency treatment that was on the surface of the skin to the next level, because now we're putting needles in. The one I have and the device I have has 49 needles. Boom, it stamps them in. The head is maybe a centimeter by a centimeter, so don't think these are 49 very fine needles. Now, when you put a device like this in, there are devices that only the tip of the needle heats, and there are devices that the complete needle heats as they go in. The devices I prefer, only the tip heats. And the reason is you might want to target fat too. You might not just have loose skin, but you might want to target some fat. And this allows us to heat the tip of the needle without damaging the exterior of the skin, where you can get hyperpigmentation. So RF microneedling, and here's the caveat, same with RF microneedling on the face, it's user dependent. There are about 15 of these devices that I can think of offhand. So you're going to think Morpheus, you're going to think Infinity, Lutronic Genius, Secret, Silfirm. There's so many of these devices out there. One that penetrates deeper, that is nice for the neck region, but also can be used on the body, is called Profound. And that just has 3 bigger needles that go in. So it's a little more aggressive treatment, but there's many of these, and there's many knockoffs of these. So watch for that. But your provider who's doing tens and hundreds and thousands of these has the settings in their mind, and will get that device to work properly if it can get to those temperatures. Those are all great devices that I mentioned. Now, let's talk about an injectable, and then I'm going to give you the final one if you have a lot of loose skin. But the injectable you want to think of, there's something called Kybella, which many of you know, but there's also the compounded version that we've used for many, many years, and that is called PCDC. So Kybella is deoxycholate, PCDC is deoxycholate plus phosphatidylcholine. That's the combination I like, and it's least expensive if you're going to use it on the body, because It's a compounded version of Kybella. Kybella can work well, and that can be used. It's going to be a little more expensive, but you'll see PCDC offered around the globe. And of course, in Korea, there's hundreds of different names of deoxycholate and Kybella-like products. But you inject these fairly superficial, just into the fat layer, and they get rid of the fat. But the key is they also tighten the skin. If done properly, in the right dose, they work well. Understand dose here, because if you just take something like deoxycholate, which is Kybella, that's 10 milligrams per ml. And if you think about PCDC, when you get a compounded, you can get all the way up to 40, 43 is common. Because it's compounded, they can't use the exact same dose as Kybella. This gets complex. But so if you go in and you get one of these treatments from your provider and you did not see the results you wanted, keep in mind, they might be using a low concentration preparation or a high one. And they might be using it 1 centimeter apart or 1 inch apart for their injection sites. It's highly user dependent. Who you see makes the biggest difference for all of these treatments. There's no question. They need to use the right product, but they have to be great at treating people. They need to treat a lot of people. I learned PCDC, mesotherapy is what many consider that. That was invented really by the French guy named Pistor, and I went to France and learned that and those techniques. And mesotherapy can be used for so many things, not just fat and skin tightening. So keep that in mind. Mesotherapy means many, many different things. I have videos on what that is exactly, but PCDC is a good injectable. Now, let's say you did those things, you're not getting your results, or you just have a lot of loose hanging skin. You really need then to surgically remove the skin. And that's a good procedure. If you have that much loose skin, you will have a scar, but honestly, it heals well in this area. For many people, not having that big hanging skin in this area, they're very happy to have that fine scar. You can cover it up. You can tattoo, of course, around it. You can do different things to hide it. But if there's that much loose skin, you're just not going to get that amount of tightening, even if you combine PCDC and RF, which is commonly done. So the aforementioned skincare, PCDC, radiofrequency, RF microneedling, they can all be done together. But if they don't work, then surgery would be your next option. Now, skin thins, and that's one of the biggest reasons that people age. So if you want to watch this video up here on how to prevent skin thinning on the face and body, you'll love that one. And one down here, all on red light and LEDs. We didn't talk about that for the body, but it works well. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.